So really just know if you didn't do this to yourself, you can't think your way out. It's not, you might have trauma and stress and other things that's related, but what chronic fatigue is and chronic fatigue syndrome is not something like a character flaw. It's not a psychological, it's a physical issue where your body has dysfunction. Hey, beautiful soul, and welcome to Dear Body, I'm Listening, the podcast for women living with chronic illness, invisible symptoms, and the quiet grief of feeling dismissed in your own body. I'm Donna Piper, and here we tell the truth about healing, the messy parts, the hopeful parts, and the parts no one prepared us for. This is a space for real talk, nervous system safe support, and learning to trust your body again, one breath at a time. Hey, beautiful soul, and welcome back to Dear Body, I'm Listening. Today we're talking about something that I have been doing for the last, year and 4 months, year and 3 months, right around there. And that is the Perrin technique. So if you've listened to my podcast before, if you're new here, I have 5 chronic illnesses. I'm 55 years old, and I live in Newport Beach, California with my husband and my cat. And 2.5 years ago, maybe not that long ago, I was diagnosed with lipedema, MCAS, and HEDS. I already knew I had POTS, never did anything about it because I didn't have to be hospitalized. And every time I talked about it, I just got a lot more gaslighting. So I have a deep mistrust of our medical system for listening, but I stuck with it and I advocated for myself in many ways. And then by following those breadcrumbs and learning more about lipedema, MCAS, etc., I was referred to Dr. Perrin by Dr. Leslie Keith, and I thought I was going to be more focused on the lymphatic system. I was having drainage issues still. I was doing MLD and all these things, and I still was like, ugh, I'm still not clearing like I should. So lo and behold, I met Dr. Perrin, and he diagnosed me with ME/chronic fatigue syndrome. I had no idea that was a specialty. I had heard of it and I knew people had it. I just didn't know the symptoms, and I never thought about me having it personally. He gave a very detailed kind of checklist of things, of symptom lists, and how you experience these things like lifestyle and etc. And then he did a physical test, and it was in the physical test that there was 5 points, and I'll talk about it in later episodes. But basically, with this physical test, he diagnosed me having ME/chronic fatigue syndrome. And on a scale of 1 to 10, 10 being like living your life, healthy, no issues, I was a 3. And funny enough, he told me, or is it funnily enough? I don't know. But he told me that I'm pretending like I'm a 7, but I'm really functioning at a 3. And that was really the kind of same sort of relief I got when I learned that I had lipedema and MCAS and HEDS. I knew things were not right. I was finally like just tears of joy and overwhelmed at the same time, because I was like, oh, great. Now I know where this like crazy fatigue's coming from, and it explains some of my symptoms, and it relates to some of my comorbidities, but I really had no idea. So he has a couple books, and usually when people have gone to him, they've read his books and they seek him out. I was the reverse. I had no idea. I got diagnosed and then I learned about it. So this book that I'm referring to is the Perrin Technique, How to Diagnose and Treat Chronic Fatigue Syndrome/ME and Fibromyalgia via the Lymphatic Drainage of the Brain by Dr. Raymond Perrin, second edition. So it's 500 something pages. He even says if you have ME, what he suggests is read chapter 1, then go to chapters 10 and 11 when you're ready. There's also a place in his book that details his technique, and also a FAQ section and related diseases, symptoms, etc. So we're going to break this all down. So it's going to be quite a lot, but it's going to be spanned over many podcasts. They may not be chronological. I am someone that has 5 chronic illnesses, and I'm getting ready to go to my second surgery. So I will do the best I can, but things also come up in the moment. So we'll see if they're chronological or not. Anywho, after I was diagnosed, I contacted one of the practitioners that was recommended from him in Southern California. I called her. Within 2 weeks, I think max, is when I saw her first. And she was on my podcast before, Tina Shin. She's a doctor of occupational therapy, and I see her for my MLD. She also does Perrin technique. So for the first good chunk of our lives together over the last year plus with Tina, it's been focused on the Perrin technique because that was my main thing that I needed to heal in order to survive or function through my life, but also with surgeries, etc., etc. So I really want to give you more information on this Perrin technique, and that's what this podcast is about because it's very personal and it helped me a great deal, and I'm hoping it can maybe help you or someone that you know. I will maybe reference fibromyalgia in here because he does. However, I have no personal experience with that, but if you know someone that also has fibromyalgia, this might be a really good resource for them as well. So now let's get into it. Real talk, the part where we tell the truth and keep it tender. So, who is Dr. Perrin and why do I go on and on and on? First off, let me give you a little context. Back in 1989, that was the year I graduated, by the way, Dr. Perrin was treating a patient for lower back pain. And after some treatments, not only did his back pain improve, but the patient's ME/CFS symptoms dramatically improved too. Within 2 months, that patient was essentially symptom-free. And that moment sent Dr. Perrin down a 30-year rabbit hole, and what he found was fascinating. He noticed that most of his patients came in not with ME/CFS. They were just chronically ill. Other doctors were like, I don't know what to do. I've exhausted this. And even though they came in with different symptoms, maybe back pain, foot pain, something else, he found that the people that had chronic issues, that had a cluster of symptoms also that have now been established in the chronic fatigue syndrome world, that there was structural and physical signs, even when their individual symptoms varied. And he became convinced that there must be a physical biomechanical explanation for this disease. And the evidence now, all these years later, that he knew and he theorized has been backing him up. So everything that he theorized actually has come through, not only in his studies with his patients, but universally. So let's talk about okay, what is the Perrin technique based on, and what is Dr. Perrin's sort of 7 key facts. So that's what he really lays out in chapter 1, is just to really kind of give the person, especially if you're suffering from ME, what it is. So let me just give you a little bit of information on who he is, and then we'll get into all the juicy stuff. But basically, he's a DO and a PhD. He's a registered osteopath and a neuroscientist specializing in myalgic ME, I can't say that second word, / chronic fatigue syndrome. He has some present academic posts that include honorary clinical research fellow at the School of Health Sciences in the Faculty of Biology, Medicine, and Health at the University of Manchester in the United Kingdom, and an honorary senior lecturer in the Allied Health Professions Research Unit at the University of Central Lancaster in Preston, UK. He is also a research director of FORME, FORME, trust and founder, and clinical director of the Perrin Clinic. Treating a patient for back pain in 1989 led him to the concept that there was structural basis to ME/chronic fatigue syndrome. And he has spent over 30 years conducting clinical trials, researching the medical facts, and shifting the scientific evidence while successfully treating an increasing number of ME/CFS and fibromyalgia sufferers. and teaching fellow osteopaths, chiropractors, and physiotherapists the fundamentals of the Perrin technique. So he has a lot of hands-on and a lot of clinical knowledge. So he has both. So that's who he is. And so I'm going to lay out his 7 steps based in or 7. He really says there's 7 facts about this disease, and he breaks it down very strategically, and they build on one another to really have you understand what it is. And that's what I'm going to go over in our next segment. The connective thread, where the body, story, and science start holding hands. Okay, so how's this all connected? So first, fact 1, he calls fluid flow. So basically, there is fluid that flows around your brain and up and down your spinal cord, and you might have heard of it. It is cerebral spinal fluid, or CFS. And most people know that it acts as a protective buffer for the central nervous system as well. But there's a lesser known function that has been quietly discussed in the osteopathic medicine since the 1860s, and that's now only getting serious scientific attention, is that CFS plays a major role in draining toxins from the brain. Think of it as your brain's waste removal service. So fact 2, getting the toxins out. So this is where the lymphatic system is a network of tubes throughout the body that acts as a secondary drainage system alongside your blood. So there's a key distinction between your blood and the lymphatic system. Who can do what? So the blood can only process small molecules. So they're called Daltons, and like water is like an 18 Dalton, okay? And then as the blood can filter through this microscopic capillary walls, so like any toxins that come through there, they go through the walls and they end up in the liver, and the liver does its thing, right, and cleans up the blood. So the larger toxic molecules need a different route. There are also hormones and other things that move through your body. I believe fat cells, different things like that. Anything that's a larger molecule goes through the lymphatic system as well. So it's a cleaning system, it's a transportation system. So for instance, insulin is like 5,808 Daltons, where water is like 18. So that's a huge difference. So what the blood can do and what the lymphatic system do are huge. And it's the lymphatic's job to move these larger molecules, because the vessels, they're smooth of the lymphatic, this tube system that's underneath like the surface of your skin. And a lot more has been talked about it like the last few years, so more people know about this. But at the time, especially with the technology we have seen in the body, it was theorized, but they had lots of different theories and not a lot of way to track it, right? But how this happens, the vessels of your lymphatic system open up wide, like kind of like gills, and they engulf large foreign bodies, and they carry many things through the body, including toxins, to the lymph nodes near. So there's many of them throughout your body, and if you follow Dr. Perry, different person, we're talking about Dr. Perrin, he has a big 6. There's other people out there that have different clearings, but basically the main place that everything ends up is underneath your clavicles, and more of your body drains into your left clavicle and these lymph nodes underneath your collarbone. So there's a lot more of those areas that could get stuck, but that's really how, if your system is working, they go through there. There's also a central lymphatic duct that goes up to your spine, and it's a thoracic duct that goes in your thoracic spine that also dumps in. So that's what should be happening if you have a healthy body and a healthy lymphatic system. And the other thing that they've seen with the brain that has only been theorized by osteopaths, but now it's definitely a system. It's called the lymphatic system. And They're inside the membranes of the brain as your lymphatic system. It works the same way. It's in both animals and human studies, and they can be visualized by an MRI scanning. So it's not just now a theory, they can see it. And Dr. Perrin had been theorizing about this neurolymphatic drainage system since 1989, and now we have proof that there's a lymphatic system, and it moves these larger toxins out of the brain. So even though there's this blood-brain barrier that people said, like, "Oh, you can't cross that," with your hypothalamus, which we'll talk about in a minute, is in charge of your hormones. And hormones there's many different ones. There's not just sex hormones. So they need to travel around so your hypothalamus can know what to do to how to balance it. So there had to be a mechanism to get these larger molecules through your brain. And it's the lymphatic system, but it also needs to get cleaned out. So if there's any sort of mishap going on, it doesn't always work like that. So now fact 3, the pumping mechanism. There has been different debates about, does the lymphatic system have a pump or not? And it does. But it doesn't have like your heart pump. It's not like that. But it does have a pump to the system. It collects vessels and ducts. These have like smooth muscle walls that contract and push fluid along, right? And then you have your main ports of this. And the main drainage channel, the thoracic ducts, is controlled by your sympathetic nervous system. And then this is the thing that gets interesting. And like, so why does he talk about all this? It's because it's the sympathetic nervous system job to help this pumping mechanism and push lymph fluid back to where it needs to go through your liver and get detoxified. However, if it is disturbed by any reason, like a structural issue, maybe you're just kind of born with a spine that does this thing. Maybe you have extra stress and the fight and flight has been turned on. Whatever the reason, if there's a disturbance, the thoracic duct's pumping mechanism can actually push the lymph fluid in the wrong direction, and that causing toxic buildup in the body. So then now let's go to fact 4. So fact 4 is the sympathetic nervous system. Most people by now, because again, it's been popularized, which is a good thing, is fight or flight. And that is the sympathetic nervous system at work. But it does far more than manage stress responses. It controls blood flow, regulates organs like heart and kidneys, and is vital for healthy lymphatic drainage. In an ME/chronic fatigue and fibromyalgia patient, Perrin argues the system has been under chronic stress, sometimes for years, in my case, decades, most people's for decades, before the symptoms even appear. And that stress could be physical, like a postural problem or an old injury. It could be emotional, environmental, like pollution, infection, or an allergy. I hope it's getting more interesting for you. It's kind of building. It's like a story. So fact 5. So let's talk about biofeedback. That's the next fact in his 7 facts. And we're going to be talking about the hypothalamus. So sitting just above the brainstem acts as the body's master regulator. It controls hormones, receives input from the limbic system, which governs emotion, memory, and motivation, and oversees all automatic body functions. So the limbic system, as they call the reptile brain, or an oldest part of the brain. It's in between the oldest part of brain of your reptile brain at the base of your skull, the limbic system, and then you have the frontal. So the limbic system does a lot of things to help, right? All of the things that the body actually does automatically without us telling it to beat our heart to do this, right? And the hypothalamus manages this through a process called biofeedback. One important detail, the hypothalamus is one of the few brain regions where large molecules from the blood can cross into the brain. I kind of alluded to that earlier when we were talking about the lymphatic system, so this would make a little bit more sense, making it particularly vulnerable when the drainage system fails at any place along the route and the toxin starts accumulating. Fact 6, what goes wrong? For hundreds of years, the central nervous system was believed to have no lymphatic drainage of its own. Now we know that's wrong because the CFS, or cerebral spinal fluid, drains toxins through tiny gaps along blood vessels called paravascular spaces. These are also called the Virchow-Robin spaces, and then out through perforations in the skull, including the bony platelet above the nose called the cerebriform plate or plate. Cerebriform plate. There are toxins that come in there, and from there, those toxins, so basically the area above your nose and between your eyes, in there, they drain into this area. And then from there, they drain into lymphatic vessels and the tissues around the nasal sinuses and along the cranial nerves. So this CFS helps pull these toxins out, right? We have a lymphatic system, we have a glymphatic system. So we have all these symptoms. And the idea is anything that comes in that our body doesn't want is perceived as a toxin, something we don't want, waste. We have avenues to get rid of them. However, they're not always functioning as they should, so that becomes quote-unquote pathological. But in ME/CFS, Perrin believes that these drainage pathways, both in the head and along the spine, are not working properly. And the causes vary from trauma, hereditary factors, postural strain, or problems present from birth. When drainage is restricted, toxins build up in the central nervous system, disrupting the hypothalamic function, which further impairs lymphatic drainage, creating a vicious cycle. Now, the last fact, the downward spiral. And this vicious cycle has a name. Perrin illustrates it as a downward spiral. Sympathetic overload leads to sympathetic dysfunction, and this causes a retrograde or a backwards lymph flow. Toxicity then increases in the central nervous system, especially the hypothalamus, which leads to chronic fatigue syndrome. Then repeats the cycle, each loop making it worse. So you have this loop, and it has been, I have another podcast where they've just vehemently said that ME/CFS is a brain issue. And this is why. Because all these systems that are supposed to be working together, and they work together, and when there is no block in that and everything's happy-go-lucky, your brain works. You don't feel fatigued. You don't have all these toxins swimming in your body. They're actually being released and processed how you should. So if you have any pathology or anything going on along these systems, then this is where trouble gets in. And then if you get a virus, so over time, all of these things kind of break down even more, and they accumulate more, so you're more and more sensitive. It's like, for me, think of filling a glass of water. So, I grew up with chronic strep throat, not knowing that strep throat now is linked to other things, but that was my main thing every year. And usually everyone has something that they get sick with every year. Not everyone in the world, but most people might get bronchitis all the time, or they might have allergies to something, but they may get there's usually something that your body does every year. Not everyone's the same. Mine was strep throat. So every year, having this chronic strain, and for whatever reason, maybe all of my connective tissue disorders, who knows? But over and over again, my body was in a constant state of stress. I was a wired kid. Then I would get sick. And then I do have a straight spine. My cervical spine's been straight for a very long time. So I have structural issues, plus the hypermobility, plus all this stuff. So my body looks kind of ripe for all these things to happen in this perfect spiral of situations. So 5 decades in, my body was like, hey, dude, I need some help. You're not helping me out. The things you think are helping are actually making me worse. Going to the chiropractor, pushing yourself, working out more and more, eating these foods that are really healthy, but they're high in histamine because I have MS. So all of these things that I thought I was doing to help my body was actually hurting it because I didn't know that my hypothalamus wasn't really talking to my central nervous system and things weren't flowing how they should. Mythbuster moment, because some of what we've been told is absolute nonsense. Okay, so that was a lot that we just talked about in the connective thread, and that's just basically chapter 1. A note about this is that we're going to get in a Mythbuster moment in a minute, but what I want to say is that even Dr. Perrin says that you need to just kind of look at this stuff first, and just knowing how things might get a mishap, that gives your system a lot of relief. I know it did mine. And then he says in his book, even though it's 500 pages, because this is written for anyone, doctors, people that want to just know information, or patients or caregivers, chapter 1 maybe is just enough for you. Just this information might be just enough and life-changing. And from there, he has you go to chapters 10 and 11, and then he also has a companion book. So just know that this is a lot, but if all you can take in is this, that's enough. So now let's do a bust a myth, shall we? So ME/chronic fatigue syndrome is basically burnout, anxiety, being out of shape. It's a lifestyle issue, or it's a lack of motivation. There's something other than biological. There's something internal that you're not doing, or you're lazy. And that is honestly so much BS. And that's created a lot of damage. One, people not knowing and then just thinking that this is all in people's heads. Doctors putting it in other than keep it in a biological structure, physical space, they pushed it over into a psychological space. And that is not what it is. It is not a psychological dysfunction. It is a physiological dysfunction. And it deals with your immune system, neurological system, autonomic system, mitochondrial, vascular, lymphatic. And it's not a motivation problem. So really just know, if you didn't do this to yourself, you can't think your way out. It's not, you might have trauma and stress and other things that's related, but what chronic fatigue is and chronic fatigue syndrome is not something like a character flaw. It's not a psychological, it's a physical issue where your body has dysfunction. And one of the ways to get through this is to get hands-on treatment like I did, and someone that's based in or have knowledge of the Perrin technique. So, really, that's really what I want you to know, that this idea that people with ME is either in their head, they're afraid of activity, or not trying hard enough, or lazy, just really needs to go away and not be part of the narrative anymore. Feel good flow. One small shift, one safer breath, one thing to take with you. So, part of the treatment is Dr. Perrin has some videos of what to do. So, you could do this on yourself, or you could get a practitioner. There's no practitioner in your area, like self-assessment, and to do this helps. So when I've kind of fallen off of it the last couple of months when I was recovering from my lipidemia reduction surgery. However, I know I need to get back into it, but I would do these things every day, and I would see my therapist once a week. So I'm not going to go through all of it now because it's just a lot, but I'm going to put the link to it in the show notes. So if you want to check it out, he has videos about what to do and how to do it. And because it's his technique, I think it is just better coming from him. But the one thing I do want you to do right now is just to take a look at everything that's been going on with your body and your health, and see if you can be at least okay with the knowledge that this is just something that you need to treat in a different way, and relish in the fact that it is not something you've been making up. And there's some real treatment out there, and there's more and more doctors and more information that really come to the forefront of supporting you. So there's way more support than there was, like, ever before. And click on the link if you're interested in knowing about what to do. And in future episodes, I will be breaking that down more. But for right now, this is a lot, right? I know it was a lot for me. This is shared education and lived experience, not medical advice, and is not meant to be. Check in with your body, check in with your clinician, and find out what fits your life. So thanks for listening. That's chapter 1 of the Perrin technique by Dr. Raymond Perrin. And next time, we're going to follow his suggestion, says I'm assuming people that are listening to this want to listen to this podcast because they have chronic illness. So he says to go to chapter 10, then 11, and then I'm going to go over the facts. Then I'm going to go over some symptoms. He has this huge appendix at the back about symptoms. Then I'm going to go over the technique, and then I'm going to go back to the chapters to really kind of break down. So it's going to be a minute. So it may be next week. I know for sure it's going to be chapter 10, but after that, I know 11's coming in the rest of them, but I'm not quite sure what order or when, because again, I'm going to go for surgery and we'll see how I do. So thank you for listening. And if you know anyone with chronic fatigue syndrome or some mystery symptoms, and their fatigue is not just I'm tired. Fatigue is really the worst name for it, but whatever, we'll figure that out in the future. Or if they have fibromyalgia, he says the same technique works for him. And remember, there's not one protocol for everyone. Sometimes it's a combination. This protocol is not meant to be forever. It's like 12 weeks. I'm a serious case, so mine, he said, was probably going to be about 3 years. I actually did really good within 1 year. However, it's still lingering issues. So everyone is on a different time frame. But if this can help you ease up your symptoms or even temporarily, if what you have been working, you're at a stalemate, you throw this in and it helps, and then it helps you to revert back to what you know helps you. Because it's kind of how it works with chronic illness. There's weird plateaus. Things work, and then they plateau out. And you kind of have to kind of zhuzh some stuff, and then what you had been doing works again. It's very complicated. I don't wish these chronic illnesses on anyone. It's really a lot. So until next time, thanks for listening, and keep listening gently to your body. Thanks for listening to Dear Body, I'm Listening. If this episode helped you feel a little more seen, a little more steady, or a little less alone in what your body has been carrying, share it with someone who might need that too. And remember, there's nothing wrong with you. You've just been living in a body that hasn't been understood. Until next time, keep listening gently.